Hello, fellow cocoa and dark chocolate lovers. I would like to quickly talk about a study that investigated the benefits of this amazing substance called cocoa. This trial was called Cosmos, and it was the first large-scale, double-blind, placebo-controlled study investigating the long-term effects of cocoa flavanol supplementation in the prevention of cardiovascular disease. Let's talk about it. So for a quick introduction, my name is Kelsey. I'm a physician associate practicing in dermatology, and I really enjoy communicating scientific literature, especially when that scientific literature relates to ways that nature can provide therapeutic benefits, such as in this case with the plant Theobroma cacao. I think this study was really interesting and deserves more attention. If you guys like this kind of content, I encourage you to subscribe and see future videos. So this trial included a cocoa extract intervention, cocoa, and a multivitamin intervention. I'm going to focus on the results only of the cocoa intervention. So there were 20,000 participants. About half of the participants were assigned to take a cocoa extract that contained 500 milligrams per day of cocoa flavanol. The other half were assigned to take a placebo. Very lame. I would not want to be in the placebo group in this study. The primary outcome of the cardiovascular portion of the study was investigating whether or not there would be a reduction in cardiovascular events. Please allow me to be a little bit long-winded for one moment to explain that a wide variety of event types were accounted for under this category of cardiovascular events, including myocardial infarction, stroke, coronary revascularization, carotid artery surgery, peripheral artery surgery, unstable angina requiring hospitalization, and cardiovascular mortality. So for the totality of different cardiovascular events, the study did not find a statistically significant reduction from the cocoa intervention. However, there was a 27% reduction in cardiovascular mortality in this 3.6-year study. Additionally, there was a significant reduction in non-fatal myocardial infarction and non-fatal stroke. Also worth mentioning, the primary results they presented and focused on in this study were based on their intention to treat analysis. This means that the data included all participants in the treatment groups they were initially assigned to at randomization, regardless of whether they stopped taking the study pills at some point during the study. So even if the participants admitted that they had stopped taking the cocoa extract pills, whether that was because they didn't want to take so many pills or for some other reason, they were still included in the treatment group, which would likely dilute any signal of protective effect from the flavanol intervention. Even so, there was still a reduction in cardiovascular mortality, 27%. The results were a little different when they interpreted the data from their per protocol analysis. This is the analysis where those participants who stopped taking the treatment were no longer included in the data for the treatment group, which I think makes sense. When applying this per protocol analysis, which only included patients who were at least 75% compliant with taking the pills, then there was a 15% reduction in total cardiovascular events. Again, this measurement of cardiovascular events includes when participants had a carotid artery surgery or a peripheral artery surgery, which are procedures done to treat arterial stenosis, which takes many years to develop. I personally wouldn't expect cocoa flavanols for a few years to significantly reverse atherosclerosis, but it is amazing that even when including these sorts of events in the total measurement, the per protocol analysis showed a 15% reduction in cardiovascular events. The authors prudently cautioned that this type of analysis may introduce potential bias, since the characteristics of the participants who can take the study pills may differ from those who cannot. So I understand why they mainly presented their intention to treat analysis data. But regardless, I think this really does make an amazing case for cocoa flavanols. And just to reiterate to you, in case you didn't fully metabolize and absorb the impact of the information I had mentioned before, in the intention to treat analysis, meta-analysis, meaning even including participants who stopped taking the cocoa, there was a 27% reduction in cardiovascular related death in the treatment group. I think that's really worth highlighting. This evidence also is not standing on its own. There are meta-analyses supporting the benefits of flavanols on cardiometabolic biomarkers, including lipids and inflammation, vasodilation, blood pressure, arterial stiffness, and insulin resistance. Cosmos is the first trial testing how these combined or individual cardiovascular mechanisms may translate into longer-term reductions in clinical cardiovascular events. I really wanted to share this so that maybe a few more people can learn about the fascinating potential benefits of cocoa flavanols. If you liked this, then please send it to a friend or family member who likes chocolate, and I will see you in the next video. I'm in love with the cocoa.